Today, we're going to give a quick overview of triage,
which is basically the term used for initial assessment of patients.
If you've ever contacted your GP surgery and been asked a few questions before getting an appointment,
or you've contacted 111 or visited A&E or an urgent treatment centre, then you've already experienced triage.
It's a way of making sure you get the right care from the right person at the right time.
The process involves assessing and prioritising patients based on the urgency of their medical needs.
Not every healthcare problem needs a doctor. A nurse, a pharmacist, or another clinician may be able to help you.
Also, non-clinical staff can help with issues that don't need to be dealt with by a GP. So, how does it work?
you'll be asked appropriate questions about your symptoms or condition, including what you're expecting from your consultation.
Based on this information, you'll be offered an appropriate response, which could include an appointment with a GP, an advanced clinical practitioner, or a member of the wider practice team.
The consultation may be face-to-face, on the phone, or digital.
You may also be directed to other services, for example, the Pharmacy First scheme based in community pharmacies.
In addition, you might be directed to urgent or emergency care if this is clinically appropriate.
If your issue is important but not urgent, you may be scheduled an appointment for a future date.
If your ongoing care is with a regular clinician, you may choose to wait to maintain continuity of care.
GP surgeries work hard to maintain access and manage demand, aiming to provide sufficient daily capacity for people with more urgent requests.
This is a way for practices to safely manage access based on need rather than demand.
Triage involves pathways put in place by GPs and trained healthcare professionals so that receptionists and care navigators can ask suitable questions
and take relevant details to better understand your symptoms, concerns and expectations.
Your request may be made online, over the phone or face-to-face in the surgery reception.
This will be assessed and evaluated by a healthcare professional to determine the most appropriate next steps.
Some patients feel as though receptionists and care navigators are just being nosy by asking why you're requesting an appointment, but they're actually doing something really important.
They're helping your doctors and healthcare professionals determine how best to help you
within an appropriate and safe time frame.
They are trained to ask key questions and work from guidance provided by your doctors to get you to the most appropriate team member.
Our reception and care navigation teams are here to help you.
Please treat them with respect.
And remember, it costs nothing to be kind.
This is modern general practice and helps us to deal with the unprecedented demands to provide you with quality care.
Triage helps to reduce overall waiting times by prioritising your care.
It minimises unnecessary delays and improves overall access to care for all patients.
Triage ensures your local GP practice can manage high demand
by focusing on delivering the right care
at the right time
with the right person.